We have had in this country, and it's even across the world, but America seems to be leading the way, an obesity epidemic, where we've seen people just in 1990s, where only 10% of the country is considered to be obese, to 2000s, 20, to now over 30% of the country is considered to be obese. That comes out to almost 15 to 20 million Americans who are considered morbidly obese, with a BMI of what we call over 40. That is concerning, because what happens when all of that weight comes along, all these other medical problems come along, whether it's diabetes, high blood pressure, high cholesterol, sleep apnea, osteoarthritis, knee problems. All of these come along with all of that weight. And so what we found with bariatric surgery is, if we can do a sleeve gastrectomy or a Roux-en-Y gastric bypass and see those great results, and you lose that weight in the first 3 months, 6 months, a year, and get back down close to a normal weight, all those medical problems are going to melt away. And suddenly you have a patient who no longer has to take insulin, who no longer has to take high blood pressure medicine, who no longer needs their CPAP machine and can sleep normal, just like they did maybe 15, 20 years ago. That is what we're fighting. What we found out is it's kind of a three-headed monster of why patients end up obese. The first is obviously our environment. If you go back and look at the portion size that people used to eat in the 50s, 60s, 70s, they're much smaller than today. Of course, also fast food has come up and all of that. We're much more health conscious, I think, on some of our food choices today than we were even 15, 20 years ago. But our portion size haven't changed that much. So actually, if you look, when McDonald's and Burger King and everybody else first came out with hamburgers in the 50s and 60s, the size of their hamburgers are what now we call Happy Meals. And now you can supersize anything you want. We also live in a culture where exercise, you have to work at exercise now. You no longer, there's elevators and escalators and everything else. Most jobs are sedentary. So you have to actually work to expend those calories. We have actual studies that show that adoptive children, their adult BMI is closer to their genetic parent than their adoptive parent. So we know there's a huge genetic component, not just it's the environment and all of that. There are multiple options in bariatric surgery. Not one surgery is the right fit for everybody. So it's getting to know them, getting to know their goals, their objectives, and where they want to go with their surgery, and then picking the right surgery with them.
When patients come in for bariatric surgery, most patients have put a lot of time and energy on the front end of thinking about the surgery, investigating the surgery, and their anxieties are high before surgery. So first and foremost, we bring somebody in, we let them know their options, talk about how the surgeries work. We really want to reinforce any research they've done, and then provide them avenues to continue their research as they prepare to go down this pathway. Typically, there's 5 options for most patients. The gastric balloon, this is a balloon that we put in the stomach and we fill with fluid, and it gives a sensation of feeling full. The second procedure is the gastric sleeve. We reshape the stomach, and with the stomach reshaped to a smaller size, it has a nice impact on the way people feel in terms of feeling full. But it also is very powerful with the hunger hormones and other issues involved with obesity. The gastric bypass, this is an operation that's been around for a long time and has very solid long-term data. The duodenal switch is another option, and the lap band. Those are the typical 5 options that we discuss for weight loss surgery. In today's surgery, or today's bariatric surgery, the risks for the surgeries are low. The mortality rates are low as well. Most people that meet criteria for surgery carry a higher risk with their living their life at that BMI or that weight than they do the risk of having a procedure. Seeing somebody come off of their high blood pressure medications, seeing somebody come off their diabetic medications, it's powerful. Not only does it help them from a financial standpoint, but from a personal standpoint. And then on the backside, I get the pleasure of seeing these patients after surgery. Lost 100 pounds. They walk down the hallway, the way they walk is different, the way they carry themselves is different. It's a huge impact, not just from a physical standpoint, but a mental standpoint. And so that's powerful to be able to see that with the surgeries we do.
My role is that I see the patient from the point of entry all the way until discharge and beyond. So I follow them post-op for up to 5 years. Well, lifetime, but like I make phone calls up on them for up to 5 years. A lot of my role is education. This is a lifestyle change for a lot of these people, so it's all about education. And I guide them through the system. I don't know if you've ever been in the hospital, but you know what it's like to kind of come in here and just be vulnerable to what goes on. So I guide them through that system. So when they get to the hospital, if they're coming either for surgery or for their pre-op visit, if they call and say, I'm overwhelmed, I'll come down and meet them, and then I'll walk them through. MSQIP stands for Metabolic and Bariatric Surgery and Quality Improvement Program, and what that is an organization where the American College of Surgeons and the American Society of Metabolic and Bariatric Surgeons came together and formed this organization, and their goal is to ensure that bariatric centers deliver high-quality, safe care to the bariatric surgery patient.
Having an accredited bariatric center or an approved American College of Surgeons center, it means that the program has been investigated by the American College of Surgeons. What they do is they come in and they look at the program, they look at the hospital infrastructure, they look at the accessibility to physicians, to board-certified physicians. They look at making sure that the patient's experience through the hospital and the system is going to be the best for the patient.